comenzar? ¿Sí? Ok. Muy buenos días y un saludo muy especial a toda la gente que ha madrugado. Para nosotros es un acto de bien y es un acto de heroísmo. En el último día del Congreso, que estén aquí presentes, y aparte nos da mucho placer que se hayan acercado a esta actividad, que por otra parte es una actividad única por sus características, así que no me cabe la menor duda que van a tener la oportunidad de disfrutarla, aprender y tener la posibilidad de colaborar, también participar con las personas que están liderando esta propuesta, tanto acá en el salón como personas que se van a conectar más adelante a lo largo de la presentación. Le pedimos a las personas que se están sumando que se acerquen lo más posible. Acá hay unas sillas adelante en la primera fila, así que se pueden acercar después si quieren un café acá, lo pueden, y estamos más en relación de cercanía. Acá adelante hay 2 filas para sentarse también, eso lo manejan ustedes. Mi nombre es Raúl Mercer, soy médico pediatra social, estoy basado en la Argentina y vengo en representación de la ISOP, que es la Sociedad Internacional de Pediatría Social, que es una entidad socia con IDPA en lo que fue el proceso de armado de este congreso. Y dentro de esta actividad hemos también tenido la oportunidad de invitar a la doctora Ziva Bagri con el equipo de trabajo que van a liderar esta actividad. Esta es una sesión plenaria llamada Inspirights, que se refiere a las buenas prácticas que inspiran los derechos de los niños y es una iniciativa colaborativa de carácter internacional liderada desde la Universidad de New Brunswick en Canadá a cargo de la profesora Ziva Bagri y su equipo de trabajo. Bueno, esta actividad va a ser muy intensa y vamos a tratar de ajustarnos a los tiempos. Para ello, la idea es que destinemos un primer momento para la presentación de la doctora Bagri, un segundo momento para darle espacio a la profesora Kirsten, que va a tomar la palabra en forma sucesiva, Kirsten Sandberg, y les voy a hacer una pequeña referencia sobre los antecedentes más significativos de nuestras 2 presentadoras. ¿Quién es Ziva Bagri? Bueno, ella es profesora asociada a la Universidad de New Brunswick en St. John y también tiene una cátedra de Derechos y de Desarrollo Infantil y de investigación en estas temáticas, y por más de 2 décadas ha tenido una extensiva participación de carácter internacional en el campo de la investigación y experiencia en áreas de desarrollo infantil y derechos. Y es una de las académicas más destacadas en crear puentes entre el mundo de los derechos y el mundo del desarrollo infantil. Ziva ha trabajado en varias universidades y también en agencias de Naciones Unidas, como así también el Comité de Derechos del Niño, la Organización Mundial de la Salud, UNESCO, UNICEF, y también ha servido como asistente técnica en la oficina central de la OMS en Ginebra. Y ella es la investigadora principal y directora del programa Global Child, que resultó en el desarrollo de la primera plataforma comprensiva para el monitoreo de los derechos de la niñez, que es la plataforma Global Child. Ella ha implementado grandes campos de desarrollo del conocimiento, así como también en el campo también del monitoreo de los derechos de la niñez, un libro que incluso ha requerido o ha implementado, estoy traduciendo del inglés, la consulta de la opinión de niños en 43 países del mundo sobre sus derechos. Y además es la autora principal de un libro que es un bestseller en el mundo académico, que se titula Monitoring State Compliance with the United Convention of the Rights of the Child. Es un libro para el monitoreo del cumplimiento de los derechos del niño a escala global. Así que, Ziva, bienvenida. Y la segunda presentadora, que también acá está presente, es la profesora Kirsten Sandberg, que es profesora emérita de Derecho en la Universidad de Oslo, Noruega, y durante 8 años ella ha sido miembro del Comité de Derechos del Niño, o sea que realmente es un orgullo contar con su presencia en este lugar. Y también fue la coordinadora, presidenta del Comité de Derechos del Niño de las Naciones Unidas durante 2 años. Su área de investigación tiene que ver con cuestiones de las leyes, los derechos de la niñez, y la profesora Sandberg es además la presidenta del Comité Científico de Inspirights, y obviamente para mí es un privilegio poder trabajar tanto con ella como con Ziva y el resto de los participantes que, si bien no están físicamente presentes, están conectados de una manera. Al finalizar las 2 presentaciones, tendremos un segmento para preguntas y respuestas con la participación de 2 colegas que están conectados a distancia. Dicha esta introducción, invito a la profesora Bagri a hacer uso del podio. Muchas gracias.
Good morning, everyone. It's a pleasure to be with you this morning. We have packed a lot of information because in order to understand Inspiright, we have to go back to the root of this project, which is Global Child. Raul briefly mentioned. So through this presentation, I'm going to share with you some information on the United Nations Convention on the Rights of the Child and Global Child. After covering these 2, Professor Sandberg is going to take over, share a couple of slides of information, and then I'm going to come back, focus on Inspiright, and tie them together. Altogether, we're going to try to wrap everything in 30 minutes so we have QA opportunity, and we can all get out of here for the plenary on time. So, inequalities in health, survival, and child survival and development are closely connected to human rights. This is often underestimated. In the words of Alston, despite this connectivity, the world of human rights, children's rights, and children's development often remained like 2 ships passing by each other at the heart of the night. They are oblivious to each other's presence, even though they are working for the interest of same precious cargo, meaning children. So this was reminded to us again earlier this century when the global community got together to assess the progress made in Millennium Development Goals. It turned out the best achievement was in MDG number 4, and in a matter of 10 years plus, we had managed to reduce global number of deaths from 12.5 to 6 million, less than a half. And that was a huge achievement. When Save the Children took a closer look, this is what we understood. On the x-axis, you see gender equity, how women are empowered. On the y-axis, you see under 5 mortality. As you can see, the more empowered, the better gender equality index, the lower is the child mortality, under 5 mortality. So this is a powerful data. This clearly shows, and of course, the gender equality benefits women, empowers women, and that has a direct impact on child development. Hertzman was the one coined this biological embedding, that quality of environments gets beneath the skin of children and becomes biologically embedded and leaves footprint on children's development. So environments are powerful. And the Convention on the Rights of the Child says that in a different way. The CRC says equal opportunities for every child must be provided in every environment as a prerequisite for respecting their human dignity and achieving maximum development. So we see really the two group of child rights and child development, talking the same in a different language. The convention, since its establishment in 1989, adoption by General Assembly, has had a global system of accountability in place to facilitate promotion of children's rights. This global system of accountability goes like this. At the country level, countries write periodical report and submit to the Committee on the Rights of the Child, and after series of reviews and dialogue with the state representative, the committee issues concluding observation. This comprehensive document is meant to serve as a guideline between now and the next report, and put the state through a cycle, productive cycle of data collection, seeing the gaps, filling the gaps, data collection again. But has this really been working for us? 35 years of convention. There are issues with this system. There are problems here, and there are problems here. The problems, the first X represents that states don't submit reports timely. And the root of it is that states often complain, we really don't know how to implement. Not every right, maybe we understand the concrete rights like education, but we have no idea how to implement child participation or having a positive agenda for children. The second problem is that concluding observations that are meant to be a guiding document often remain dormant, and they are taken out just a year before the next report. So going through and witnessing these problems through our work with many, many governments across the world, at some point in 2016, we got a group of world experts together and embarked on the task of a huge task to operationalize these rights, to operationalize 41 substantive rights of children and use human rights indicators to explain what does it mean, what kind of policies and laws we need to have to promote children's participation, what kind of processes, and what would we see at the child level to understand how children are enjoying this right. So at that point, the outcome of this comprehensive operationalization became Global Child Platform, a comprehensive child rights monitoring platform that was done through a work under the guidance of the United Nations Committee on the Rights of the Child. That meant annually I went once, sometimes twice, to Geneva and got audience with the chairs, different chairs of the committee. 6 chairs were involved, including Professor Sandberg. The chair gave us time. We presented what we have done so far, and we sought out committee's advice and came back to the headquarters was in Canada, but we had members all across the world. So we finally made this Global Child Platform, which is funded by Canadian federal funds, has operationalized all substantive rights, designed to enhance accountability of states to their children, provide a simple, user-friendly tool to implement, but also to monitor children's rights, and through data collection. The whole tool is a data-centric. It guides for proper data collection. And we took the 9 cluster of report writing. Under each cluster, as you know, there are a number of articles. For example, cluster 5, violence against children, has 2 articles. For each one of articles, we have indicator set 19, indicator set 34. So altogether, 41 indicator sets, and all these indicator sets have the same generic structure. They have series of structure-related questions, series of process-related, and series of outcome-related. Structures ask states about policies, legislations, laws, that could facilitate, that could promote implementation of this right. Process and indicates respect to that right. Process asks about processes. Are they non-discriminatory? Are they in the best interest of child? Are they promoting child development? And that indicates protection of that right. Outcome, of course, is the way to understand to what degree we have fulfilled these rights. We see the change at child level as the right holders. Example I give you from excerpt from Article 19, Protection Against Violence, Neglect and Abuse. Example of structured questions is, has the state criminalized corporal punishment against children? Example of process question will be, are there initiatives to raise awareness and prevent violent physical and emotional disciplinary measures on children, educating parents, informing, empowering caregivers, school authorities? And the example of outcome question would be, has there been a reduction in the rate of violence against children in the last 5 years, meaning since your last report to CRC? Of course, this periodicity is changed now, and we understand the committee is moving to a longer term, like 8 years or so, but previously was 5 years. And when the state's answer to that question is no, we try to provide some ways to start to fill that gap in capacity. If there is no awareness raising measures, we suggest something like positive parenting education and give a link to Canada's Nobody's Perfect. In service training, we provide a link for CRED Pro, education of professionals, and public education. So we put together a very high-level steering committee comprised of number of former chairs of the UN and from different regions of the world. We did a global consultation, and what we are very proud, the most important part of consultation was consultation with children through a global study called Global Child Rights Dialogue. Through collaboration with UNICEF and Save the Children country offices, we set up focus group in 52 centers across the globe, from Moscow to Buenos Aires, from Shanghai to India, and anything in between. And we created child-friendly versions of children's rights and asked children's opinions on how would that right be fulfilled or violated. And we incorporated them into the Global Child Platform. We also published the outcome of these 3 years of research in an open access book which is free online. And this book was accessed over 1 million times. So encouraged by that, we also published the Book of Indicators. The exact indicators that are in the Global Child Platform are in this book. And we also put some of the good practices that we came across and we knew that would promote the children's rights. Now, I give the podium to Professor Sandberg to speak a few slides, and then I come back to talk about Inspiright.
Oops. Thank you, and good morning, everybody. It's nice to see you here. I was a member of the Committee on the Rights of the Child, the United Nations Committee, and as was mentioned by Raul earlier on, and this is Article 4 of the CRC saying that states have obligations to undertake all appropriate legislative, administrative, and other measures for the implementation of the rights recognized in the present convention. So they had to take all sorts of measures. And this is the main, maybe, article that the committee has to monitor that states actually do what they are supposed to do under the convention. But then states come to the committee and say, well, I should say first that the United Nations Committee on the Rights of the Child gives recommendations to states on what they should do. They have to improve on this and that. They have to stop using corporal punishment, for instance. That was an example before. And then states asked the committee for good practices. Do you have any models, any examples that we can use? Otherwise, we don't know how to do this. And the committee doesn't have any collection of good practices. That would be beyond the scope of the administration of the committee to actually do that. But if we had a collection of good practices, we knew that states could use examples from such a collection from other states to get ideas as to how to fulfill their rights, their obligations in implementing children's rights. And not only states could use it, also civil society organizations and anybody else who would like to set up some program for children could get ideas from what happens in other countries. It's really difficult to know about that when you are in a different country, maybe even a different part of the world. So you could set up similar programs or projects, or push their governments to set up similar programs. And this database that has now, or is in the making. The UN committee can refer states to this database and then in that way strengthen states' accountability to children's rights, which is what Article 4 is about, that they should be accountable to children for implementing their rights. So Ziba is going to describe more in detail what this whole Inspirights project is about. But it's not only about collecting practices that people around the world think are good, because not any practice is suitable as a model for other countries, only if it can be labeled a good practice or maybe a promising practice. That's when it can be used by other countries. And the practice has to fulfill certain requirements to become labeled a good practice. And Ziba will talk more about that. But of course, practices can never be copied just right away. They always need to be adapted to the context in each and every country. But still, to have some examples to use as a starting point is very useful, we find. So now back to Ziba.
So with that background, no more movement, I promise. We're wrapping up. With that additional insight brought to you right from the inside of the committee by the former chair of committee, we thought we will embark on another project to strengthen the accountability to children, and we call that Inspirights, practices that inspire children's rights. What we did through this project, it was another 5 years project by federal funds of Canada, and offshoot of Global Child, because we wanted to make Global Child platform, in addition to monitoring tool, a capacity building tool. We didn't want to leave the state out on a cold, but we wanted to leave with some suggestions. Look what is Tanzania doing to Kenya. Look what is Vietnam doing to Turkey, etc. And we conducted this in collaboration with another international team of experts, each one prominent scholars, child rights advocates in their region, 7 regions of the world. These are the members who are not here today. Professor Sandberg chairs our steering committee. Professor Namazova will join us from Pergava University of Moscow. As you can see, these are from different regions. Then Professor Ulker, from his previous ECD, head of UNICEF from Ankara. Dr. Raul Mercer, a renowned pediatrician from your region. Mr. Yehoshua McKinnon from African Child Policy. Mr. Adam Arkadas, experienced and very well-versed child rights experts from Mediterranean area, and myself as the principal investigator from Canada. So together we embarked on this 5 years project. We wanted to understand what are good practices. It took us a whole year to design a decision tree. What are the factors and criteria we should see in these practices? Proven efficacy, addressing certain rights clearly, providing relevant examples to states, national, subnational level, etc. And good practices focused on legislations, policies, programs that inspired fulfillment of children's rights under CRC. We first started by developing decision tree. We made scores, what will add up to good practice, and some practices may be very close to be good practice, but not quite there. We called them promising practices. And then we did a pilot survey in North America. We set up the survey. People nominated their practices in North America. We reviewed, analyzed, scored, and categorized North American practices. Upon that, we refined decision tree further and then launched a global survey that went to all regions. It was a global social media campaign, and then review, analysis, and of the nominated practices. So this was the practices nominated, the process, practices nominated through a survey platform. Then preliminary screening to cluster them based on clusters of rights. Then prepare a two-pager justifying the score we give them based on the nominating people provided us some information, a web page or the country this practice is now from, or contact information. Then we went on information hunting and compiling and providing a two-pager that is really substantive and with supporting evidence that this is good practice for such reasons, or it is proper practice, or not, none of them. We deleted many. We had about 1,000, maybe less than 1,000 nominations, and we ended up with less than 200 good practice and proper, and then cross-reviewed and critiqued each other's two-pagers between our team, the 7 of us, and finalized the practices. So how would these identified good practices serve the state? As Kirsten mentioned, they would provide examples of good practice closest to their content, because we have also classified them based on level of development of countries. So, for example, for children's rights to participation, we have Young Children's Parliament from Scotland and Canada. We have our Children's Trust in States, and then we have Minunun Circasi from Turkey. So if somebody wants to go understand, we put a link to Minunun Circasi, and they go to the website and read more about that. If somebody wants to know what is about we also, for example, Scotland's Children's Parliament, if you click on that, we go to the two-pager. Why is it good practice? How did it scores? What elements were in place? What elements weren't in place? Was it ever monitored? Were children involved in monitoring or evaluation and all that? So I want to wrap up with saying that Global Child was built in response to the need that states parties challenged with how to implement and monitor the implementation of CRC, to enhance the accountability of states to children, and to provide tools to states as well as the committee. And Inspirights was a response to states parties' general experiencing of challenge with understanding what kind of practice, what kind of policy would promote which one of the rights. And together, increase our accountability, enhance our accountability to children, child development, and children's rights, because, as I mentioned in this start, children's development are quietly associated with their human rights. Thank you very much.
Muy bien. A los fines de ajustarnos con los tiempos, la idea es abrir el espacio para preguntas y respuestas y también vamos a abrir un espacio virtual para que se sumen, serían las personas, pero hoy es la persona porque estábamos esperando una segunda colega que lamentablemente no se conectó aún, pero sí vamos a invitar a Adam Arcadas. Por favor, si lo podemos conectar e invitarlo para sumarlo. Y mientras tanto, abrimos el espacio para las preguntas y las respuestas que se encuentren en la audiencia. Mientras tanto, por lo menos, voy a presentar virtualmente a las dos personas que habíamos convocado, una presente y otra por el momento ausente. En primer lugar, la doctora Leila Namazova, que es pediatra de Rusia, presidente de la Asociación Rusa de Pediatría, experta en abogacía también en temas de derechos del niño y también integrante del equipo de Inspirights junto a otra colega más, Natalia, que hoy no está acá, pero bueno, hay un equipo trabajando en forma apareada en Rusia. Así que esperemos que se sume Leila. Oremos a ver si aparece o no, y si no, nos quedaremos con las ganas, pero luego habrán formas de conectarse si alguna persona está interesada. Y a quien sí tenemos felizmente presente acá con nosotros es un colega, amigo, compañero de trabajo de muchos años, que es Adam Arkada Tibert, que es consultor senior, investigador y experto en abogacía en temas de derechos del niño con una extensísima experiencia, no sé cómo se traduce extensísima, en países de Europa, fundamentalmente en países de la zona de Europa del Este, pero tiene recorrido, yo diría, de carácter global, incluso participando en temas de abogacía, incidencia, en zonas de conflicto, y es miembro también de la iniciativa Inspirights, pero además es colaborador y asistente en los aspectos relacionados con este y otros proyectos, dada su conocimiento y experiencia. O sea que es un promotor de los derechos, pero también trabaja en aspectos de resolución y restitución de derechos en aquellos lugares en donde los derechos de la niñez han sido violados. Así que, Adam, I'm talking about you. Good words. So I welcome, and if you want to say some words just to introduce yourself, I mentioned who you are, but if you want to make any comment before we get some questions. O sea que la idea es...
Buenos días, saludos, Conde Salanica.
Ok, gracias, Adam. ¿Alguna pregunta, algún comentario? Acá tenemos una mano levantada y les pido si por favor pueden acercar el micrófono.
Good morning. My name is Nandita D'Souza. I work at the Setu Center for Child Development and Family Guidance in Goa, in India. I needed some inspiration this morning, and I had no idea about this session, but I like the name of it, and I think I made the right choice. Congratulations on your work. It's so heartening to hear what you all have done, especially because when we work on the ground, we are very much kind of committed to implementing policies, but honestly, when we read those policies, we just can't understand what we're supposed to do. And to the way you all have gone from policy to practice to kind of analyzing outcomes and performance, I just love that flow. My question is, at Setu, we believe every person is a person, no matter how small, and that when we protect child rights, we also have to protect the parents' rights, the teachers' rights. We cannot protect child's rights by being disrespectful to adults who may have been disrespectful out of ignorance or fear. So we have a very strong institutional child protection policy. Now, do you all have anything in your good practices related to institutional child protection policies? Because to my knowledge, in my region, we are the only not-for-profit which works in the field, which has a strong child protection policy. And I think it's so important that every institution, whether it's not-for-profit, private, government, must have a written child protection policy which is publicized and on their website, if they have one, so that they have to walk their talk and everyone knows what their talk is. Yeah, thank you.
Thank you for your comment. Both Ziba and Kirsten, would you prefer to be there or would you like to come to the podium? You need to use the mic. Please come here.
If I understood your question correctly, it was about having a child protection policy within your organization. Is that so? Yes, I know that at least that the organization CRIN, Child Rights International Network, has a very strong child rights protection, child protection policy that was made a couple of years ago, I think. And I know other organizations are working on this as well. Quite a few have a policy now, I think, in place. I cannot name others. I don't know if you can, Adam.
There are too many to count, especially from European and North American region, but also from Africa and Asia as well.
But we certainly agree that this is important. It's really something that all organizations working with children should have. Yeah.
I also want to add that
Use the mic.
To the end of this, to year 5 of this project, but we welcome if you have nomination. Like, we know that policies are cornerstone of change. We have to have that structure. Wherever we see desirable child level outcome, often originates from that project, that structure. We have amazing programs from India, such as Butterfly Children of Butterfly, which is child protection program. But it would be nice to see structure, process, outcome. And if you think you know of a practice that has been producing good results for children, please contact us.
We have another question here.
Hi, both of you. My name is Sara Hernandez. I work in Bukuka Walk, and I have a master's in child rights, so I'm really excited to hear this from you. I'm going to make the question in Spanish because it's easier for me. Quería saber, primero, pues agradecerles a ustedes por su presentación, y segundo, quería saber cuáles son algunas de las limitaciones o barreras que han tenido al implementar Inspirights con algunos de los países, específicamente si se pudiera hablar de Latinoamérica, les agradecería mucho. Muchas gracias.
It's not the limitation in implementation, because we were just trying to compile a global inventory, and we're not even claiming that this is an exhaustive inventory. We just collected what we can. That's why I'm encouraging all of you, if you know something, nominate to us, communicate with us. What challenges we faced, if we can rephrase your question, instead of limitations in implementation to challenges in compiling this inventory, was that often people who have dedicated a lifetime to a given policy or program, they become very emotional about it, and they think that a small practice in country X that gets children out of school and keeps them busy with raising chickens, which has produced good results in that district, can qualify for good practice, replicable in other jurisdictions. And we were very careful how to not discourage people when we are not categorizing a practice as a good practice or even a promising practice, but also applaud the efforts put in those small but meaningful practices. One of the criteria for us was replicable, to be able to scale it up to in other jurisdiction or scale up from smaller place to bigger or nationwide. So I don't know if I answered your question. You're welcome.
Thank you for the talk. It was very good. My name is Dr. Wadeen, and I welcome you to disagree with my premises if you think so, but when I look at history of workers' rights, I feel that governments that guarantee rights typically respond to power. You know, workers, they formed labor unions who took away who used money in building financial assets and voting blocks, and that's what governments respond to. Now, children, they don't vote, and they don't have much money. I thought the graph that showed that women being empowered led to kids' rights was very telling. To me, it seems empowering mothers, giving mothers as much power as possible would be one avenue. But have you thought about ways of promoting power, giving power to children? Because it seems that's what most governments respond to. There are ideas of letting 16-year-olds vote, 14-year-olds vote, but when you think of power, have you thought about that and any practices involved in that? I don't know if that question makes sense.
So Kirsten or Adam, do you want any one of you to respond to that?
I don't exactly understand the question, but the premise is there and well justified. That's actually why as adults or the community should protect children's rights along with children themselves. So that's why, for example, several articles of the convention is dedicated to participation of children, the rights of the children to be heard, to be listened to have their voices heard and their voices turned into power. So yes, it is there within the convention, but in our work, the IDPA Right and the Global Child, children's participation is as embedded as it can be. For example, Ziba talked about having children's consultation with Global Child, Inspirights as well as no, not with Inspirights, but Global Child. Because this is about good practices, the issue of power and the participation of children is part and parcel of the criteria or the criteria that we set for any activity or any practice to be characterized as good practice or promising practice. If it doesn't have child participation embedded in it, we don't accept it as a good practice. I don't know if it answered your question.
Add?
Yeah.
I think there's a really good answer from Adam. It's about children's participation, and that is all about children's empowerment. And that doesn't mean that children should necessarily be autonomous from an early age, but they should have a say and they should be listened to. And that is a way of giving children a form of power in their own lives and also in society, like we saw Children's Parliament from Scotland, for instance. So a gradual change in that direction is what we are striving for, in addition to everything else with children's rights. Thank you.
Gracias, Kirsten. Gracias, Adam. Me están haciendo señales con el cartel de que tenemos que cerrar. La vida es así. Pero algunas palabras de esperanza. Por un lado, los que tuvieron la oportunidad de participar de esta sesión se han enterado de un proyecto que hasta hace una hora no estaba en sus mentes, en su conocimiento. Segundo, hay gente en todo el mundo trabajando en estas líneas de trabajo y es una buena oportunidad para vincularse y entender que están las puertas abiertas para trabajar de manera colaborativa para promover y defender los derechos de la niñez. Recién se habló de la cuestión de autonomía, de la capacidad de agencia, así que en la mañana de hoy van a tener la dicha de escuchar una conferencia a cargo de Jerison Lansdowne, que está acá presente, y que además es colaboradora de este grupo de trabajo sobre el tema de las facultades evolutivas del niño, así que esta temática de una manera u otra va a ser retomada. Por nuestra parte, simplemente agradecerles la presencia en el día de hoy, y nos seguimos viendo más adelante. Hasta pronto.